Good morning. We'll be starting here shortly. We would like to welcome some of the following people who have joined: Mark McLemore, Mark Welch, Melanie Bray, Richard Davis, Tim Stark, Stacy Orr, Terry Streeter, Tressa Ross, Lou Carter, Kathy Stanfa, John Mark Roberts, Jeremy York, Heidi Schultz, Gidget Manning, Gail Sharp, Emily Parker, Dana Howard, Don Robertson, Mr. Bob Jackson, Burton Young, Ashley Gibson, Amy Futrell, Abby Hensley, and anyone whose name I'm not seeing as you come into the room, welcome. We'll get started in just a moment. Hawkins Teague, welcome. LaCosta Hayes, Leslie Palagrudo, Linda Avery, Lisa Ferris,
I'm showing my screen right now, so I think it has to be. All right.
Good morning, Sheila Walker. Happy to have you here. Sally Hopkins, Renee Pfister, Paul Reister, Brenda Rowland, Aaron Dale, All right. Good morning. Good morning. Good morning. As one of my dear friends, Gary Evans, always starts his morning announcements out saying, and I am so, so happy that even though I can't see every one of your faces, that we are having our very first ever virtual breakfast with the Murray Calloway County Chamber. So to all of you who are still rolling in, go ahead and get your cup of coffee, grab your muffin, sit down and enjoy today. We would like to thank Lake Chem for being our sponsor of this morning's breakfast. Thank you so much, Jessica, for being here to introduce our speaker. To Mr. Penner, thank you so much for joining us and being willing to do this. And on a personal note from the board, thank you to everyone who is employed with Murray-Calloway County Hospital for all that you have done in 2020 and 2021, and for many years before that. We want to thank you. Today is a little different, but that's okay. We have learned some things to make technology a little bit easier. I sent Haley and Michelle a text this morning and I said, you've done all you can do. If technology messes up, that's okay. You have rehearsed everything that you possibly can if something goes wrong, but we only have so much that we're in control of if 2020 taught us nothing else. A few things. On behalf of the board, we want to thank each and every one of you as members for continuing to believe in something that has been in our community for well over 90 years. We're getting to that 95-year mark. And so it's an important thing to have the Chamber of Commerce. Thank you for supporting all of us, especially Michelle and Haley. I sent a letter out on behalf of the board this year as membership was rolling out. It's been difficult for you as members and for us as a chamber, but thank you for your continued support. One thing that you will always hear me say is I think Murray and Calloway County is the best place and the greatest place that you can ever live. And I continue to believe that. And I believe that today is we're going to hear from some very important people in our community who have had a very, very firsthand interaction with what we've been dealing with and what's made all these changes. As we march forward, we look forward to more virtual breakfast. Next month in March on the 18th, we'll be privileged to have Congressman Comer join us all the way from Washington, D.C. So that's going to be new and different. But continue to just hang with us. You're going to see some new things come out that Michelle and Haley have worked really, really hard on. The board has worked really, really hard to make sure that we are making sure that the members are getting everything that they are supposed to. I want to thank Michelle and Haley personally today as we are here with about 100 folks on. Thank you for what you did in 2020. Thank you for getting out information on PPP, PPE, unemployment, and everything that was going on at the state level. If I left out any letters, I apologize. At this point in time, it is my honor and my privilege to turn over the speaking time to our President and CEO, Michelle Bundry.
Thank you very much, Jeanette. We truly appreciate your leadership on our board. What a year to be chair of our board with 2020, but we're hoping it's behind us and ready to move forward with the new year. We truly appreciate all of you for joining us. Normally, I get to see you all in a room with coffee and bacon, and I get to shake your hand, but this morning is different, and that's okay. We're going to roll with it. We are going to hear a community health update, which is probably the most critical piece in helping us overcome and recover from this pandemic in our businesses and in our lives. So we are excited to have Mr. Penner here with us this morning. Again, thank you. I know Jessica's here representing Lake Chem, who is our presenting sponsor. We truly appreciate you allowing us to have these breakfasts, and you guys are always so easy to work with. So thank you for joining us this morning. And thank you for all of our corporate partners. Our events could not happen without each and every one of you. So we appreciate your continued support as we are trying to bring you events, and virtual may be what they look like for a while, but we are fine with that. We announced that 10 of you are going to be winning door prizes this morning, and I'm telling you, I may steal some of these, but we have some gifts from Flowers by Whitney. We've got some gift cards for Auto Spa and Finish Line Car Wash, Future Grounds, and Schaefer Coffee. We've got some chamber checks. So Haley's going to be reaching out to you in the chat for those winners of those gifts, but we really appreciate you being here this morning. Thank you to all of our businesses in our community who donated door prizes so that we can give you guys a little happy for today. Before we dive in this morning, we want to just review with you all the annual report from 2020. As members, you're invested in our organization, and this helps hold us accountable for what we're doing and how we are investing. Your investment is getting a return. So we're happy to share with you a little bit about our annual report for 2020. You should have received this in an email, or you should have received it in the mail. If you want a copy, let us know. It's also available on our website at www.mymurray.com. I know 2020 was very challenging for all of us, and the chamber recognized very quickly that we had to do things a little bit differently. We started out the year as National Chamber of the Year in 2019. We passed that baton to Effingham, Illinois this year, but we had the year planned with lots of events and lots of things that we're used to doing, some brand new initiatives. And of course, on Friday the 13th, March 13th, is when everything sort of changed for us, and we had to cancel our events, all of them, for the remainder of the year. So, or in person, I guess I should say. But we are proud to say that last year we won 3 state chamber awards from the Kentucky Chamber: Excellence in Publication, Excellence in Events, and Excellence in Website. And so we remodeled our website in 2019, which is a really critical piece for us in helping get members information quickly through the pandemic as well. Pre-COVID, we had several events. We had 2 business at breakfast, which in January, we had a city county update where we heard from Judge Executive Kenny Imes and Mayor Bob Rogers. And then in February, we talked about the census and how critical that was for our community to get dollars through people taking the census. We had our largest attendance to Calloway to the Capitol. We took 46 people there, and we got to hear from a lot of state leaders, Secretary Gray. We had meetings with several legislators, participated in West Kentucky Thank You Night, and got to hear from the governor that night as well. Then Leadership Murray got to participate in several things, and then our YPM got to also go to the Capitol and do some things last year, pre-COVID, pre-March. So we got 2 months of events like we were used to. So quickly, the chamber saw that we were going to have to change things. We sent out some member surveys to hear from our businesses. What can we do to help you the most? And what we heard was we need information on the legislation coming out on PPP, on PPE, on unemployment, and many other things coming down from SBA. We heard lots about the stimulus checks and lots of information about that. So we quickly wanted to connect our members to our leaders, national, state, and local. And so we organized several Zooms and conference calls, which all of these that were able to be recorded can be found on our YouTube channel. So make sure to go check that out if you want to hear from any of these. But we heard from United States Senator Mitch McConnell, Congressman Comer. We got an update on the elections from Secretary of State Michael Adams. We got to participate in a call with Lieutenant Governor Jacqueline Coleman on WKMS, and lots of calls and webinars on unemployment insurance. We got to hear from the mayor and the judge last summer, and then we got to start a plugged in series. So if you missed that, all of those things are on our YouTube channel. You'll see they're listed, who we got to connect you with through those Zoom calls and conference calls. We knew that one of the concerns just from our survey was that members felt like customers didn't feel safe shopping with them. So we wanted to quickly go into where we could help promote our members. So we created a business toolkit where you can have signs that say, yes, we're open. We went out and took pictures of our businesses that were open and encouraged people to safely shop with our businesses. We know that the restrictions may have kept people from going in person, but a lot of our businesses adapted to having curbside or drop off or pick up. And so we wanted to help promote that. We also promoted several shopping events, Black Friday, Small Business Saturday. And last year we sold over $10,000 worth of chamber checks, which all of that money stays local in our community and can be spent at our local businesses. So that's a program. We appreciate people's support. And like I said, today we're giving away a couple of those so that you can go spend those locally as well. We created a Love Local campaign this year where we encourage people to love local by shopping local, play local, eat local, anything you can local before you go out of town. We want you to think, can I get that service or that product here locally before I go out of town or before I go online? And so we created that campaign, as well as other things like Give Local. We want everyone to encourage people to give local to our local nonprofits as well. How do we engage members in 2020 virtually? We were able to go on WKMS and go on with Journey to help connect members to information quickly. We sent emails and posts on social media platforms just to get information out to our members. Despite a crazy year, we had 23 new members. We're so proud and so encouraged by members reaching out to us to join. Don't forget, we have job postings online. We get asked about those all the time. And then our rent lists are always available in the office or online. So we try to take everything we could that we do online. And so you can check out those things not only on our website, but on our social media pages as well. Member resources, like I said, we updated the website in 2019. And so if you go to mymurray.com, you'll see a lot of our member resources that we created a COVID-19 page. Tons of unemployment information, PPP, SBA information. We created a virtual tip jar. I know that the service industry really was impacted by the pandemic and the restrictions that came down. So we created that as an opportunity for you to continue to tip your servers that we all appreciate so much. So that's on our website as well. The Back to Business Toolkit, if you're interested in more information on that, you can definitely visit that. But it's a huge resource for our members with over 68,000 member page visits. That means they're going directly to your business to look for your information, and lots of calendar events. So if you have an event, be sure to post it on our website. So chamber initiatives that we did last year, you can see here casual conversations with women in business. The Chamber Advantage program, if you are a small business with 2 to 50 employees and are interested in health insurance savings, be sure to reach out to the chamber and we'll get you connected. We have about 10 businesses that have taken advantage of this so far. It's a great opportunity to provide the benefit of health insurance to your employees in an affordable way. Also with workers' comp, we have a program we can connect you with as well. And hopefully this year we can start some of our school leadership initiatives that we were wanting to do. We had to put the brakes on those in 2020, but we are very excited to hopefully maybe this fall restart the Leaders Initiative for Teachers, which is called LIFT. And you can see some other remote work programs and things like that on there as well. We're always wanting to partner with our regional partners. So you can see on there the various organizations that we partnered with in 2020. And you see a list of our board of directors as well. Our staff are Haley and I. So if you have any questions, please let us know. And we are always happy to serve you in any way. And lastly, I'm going to talk about our priorities for 2021. Business leadership is what we're going to focus on. Membership services, community development, operational excellence. You can also find this on our website. I won't go into too much detail today because I know we want to get to Jerry Penner, but we want to continue to be leaders in our community, helping our members connect to services and resources that they need, helping develop our community, that we are a community of choice and that we can retain people here in our community. And we want to be excellent stewards of your investment in our organization. And we also want to make sure that we stay on top of trends and influences that impact our businesses, like technology, diversification of business. And so we are focused on those things in 2021, and we are proud to be your chamber. So with that, I get the opportunity to turn it over now to our presenting sponsor, and Jessica Adams is here representing Lake Chem. Jessica is the marketing director for them, which will be celebrating its 50th anniversary this year. So congratulations, that's exciting. Lake Chem has been named the best credit union in Murray for the past 3 consecutive years, earning their place in the Murray Business Hall of Fame. Jessica is a member of Young Professionals of Murray and a board member for the Kentucky Lake Young Professionals. She is currently serving as the chairman for the Kentucky Lake Chamber of Commerce. She has been recognized by the Kentucky Credit Union League in their Emerging Leaders Program and was the recipient of the Richard Zimmerman Outstanding Young Credit Union Leader Award. So Jessica, we truly appreciate you being here this morning, and I'm going to turn it over to you now to share with us.
Good morning, everyone. It's crazy to think that it's been almost 2 years since I spoke to you at the last breakfast we sponsored, which was in May of 2019. And the world pretty much hasn't been the same since. And I know everyone's so ready for everything to get back to normal, but it's been extremely uplifting to see how our community has rallied together to support each other and all the local businesses during this time. So it's hard to have an upside during all of this, but having this amazing community definitely makes any challenging time 100% worth it. I'm going to introduce our speaker during this time. He's had a lengthy experience and is well worth his position. And we're so thankful to have people like this in our community. But the retired Colonel Jerome Penner III serves as the Chief Executive Officer of the Murray-Calloway County Hospital in Murray, Kentucky, a position he's held since April 11th, 2011. He obtained his military commission through the Army ROTC at Murray State University in 1982, graduating with a Bachelor of Science in Biology and Military Science minor. Jerry was in the U.S. Army serving all over the world in a challenging leadership assignments from medical platoon leader to brigade level command. Most notably, Jerry served a 12-month combat tour in Iraq from December of 2004 to November of 2005 in support of Operation Iraqi Freedom as the Chief Operating Officer of the theater's largest trauma center. He ended his military career as the Commander Chief Executive Officer, Madigan Army Medical Center. Jerry officially retired from the Army with 29 years of commissioned service on June 30th, 2011. Thank you so much for your service to this country. Jerry holds a graduate degree in healthcare administration from Baylor University and strategic studies from the U.S. Army War College. He has been awarded many military and civilian medals, awards, and certifications, including Expert Field Medical Badge, Airborne and Air Assault Badges, the Honorable Order of Saint Barbara, and the Order of Military Medical Merit. He is a board-certified healthcare administrator, and Jerry is a fellow with the American College of Healthcare Executives. Jerry was a 5-year Murray Calloway County Chamber of Commerce trustee. He served on the executive committee of the Board of Governors at the Murray State University Alumni Association, culminating as president. He served the Kentucky Hospital Association in multiple roles and served in leadership roles in many other organizations. Jerry has been married for 34 years to the former Jamie K. Shelton of Gideon, Missouri, and they have 2 sons, Jerome and Jason, and Bella the Schnauzer. Thank you so much for this opportunity, and we're so excited to hear from you.
Jessica, thank you so much. And I hope after reading that bio that we have any time left to actually talk about the issues this morning. And also thank you to Lake Chem for being our sponsor this morning. And I'd be remiss if I didn't say the same thing to Michelle and Jeanette for what the Chamber's done and keeping us together. Congratulations on your award last year. And I'd love to see you do it again here in not too distant future as we go down the line. So with that, folks, I know some of you are in fuzzy slippers relaxing. Some of you are doing other things out there. I'm going to see if I can share this screen here real quickly. There we go. So we always love it when technology works the way you want it to work. So this morning, I appreciate the opportunity to talk to you about some things as my heart goes out to businesses first and foremost, because I know you've had a very difficult year. And as your year has been miserable, mine's been just the opposite because of the environment in which this pandemic has placed our community and this great nation that we serve. So I want to try to keep this as brief as I possibly can. I'm going to take you on a 10-month journey talking about some of the things that this hospital has, your local hospital has endured. Talk a little bit about our admissions and some of the processes and things that we've run into. Talk about some of the tools we have to fight this virus. And then last but not least, I'm sure as everybody's sitting on the edge of their tables wondering about this vaccine horizon, and we want to be able to come out of this so that we can get back to a normal life, normal businesses, getting the folks coming in and wanting to do what they want to do in our community. So really stepping back to February of this year, we had it got extremely busy, even though the pandemic hadn't hit us yet. Here in this particular area, we had pretty sparse with the number of COVID-19 patients that we had come through. But believe it or not, starting back in February, we had a stakeholders meeting, and that involved the health department, Murray State University, our local school system supers, the clinics around the area, and a myriad of about 38 folks got involved and really talked about how this thing was going to impact us. And some, for the hospital perspective, a lot of intense preparations, as you might imagine, not knowing what we were going to be facing at that time. And some really, really key things I just want to point out to you, really creative, our engineers and facility staff put together and we flipped a couple floors. Usually our 5th floor was our surgical floor, our 4th floor is our medical floor. But through some really, really smart acts, we changed the HVAC system and created an entire negative pressure floor on our 5th floor. And that became our COVID floor in preparation for what we thought was going to be really bad, and has been. We added some UV scrubbers in our HVAC systems to allow this recirculated air to be killed to some of the pathogens that would be flying around. So we did a lot of things to make sure we kept our staff safe and also kept our patients that were already in the hospital safe as well. It was a very tough thing for us when the governor's mandate came out to close our elective surgeries. That was tough. And if you can imagine putting your surgeons on the shelf for about a 60 to 90-day period, that's hard for them to have to stomach, because surgeons want to do what surgeons do, and that is to work. Now, we were given the blessing through the governor to have our own regional drive-through testing site, and I got 22,000 out there, and that's the number of people that we've tested since we opened this thing back in the April timeframe. And it continues to run at a pretty high volume today as people want to find out. And well, it helps because, one, we can keep them quarantined, and two, they want to make sure they're not spreading to the people around them. During that time frame, our clinic and ER volumes absolutely plummeted. So as much of you and your businesses took a hit, so did our ER. People were afraid to come in. They were just really afraid to come in, thinking they would catch a COVID disease. And I can remember a story that one of my physicians told me, that a patient called him it was actually a Tuesday night, and said, I think I'm having a heart attack. And he was urged to come in, and the person's comment was, well, I don't want to come in. I'm afraid I'm going to catch COVID. And sadly, by the morning, that person had passed away. That's a tough thing, to be scared of this disease that we have around you, but it's a pretty much a righteous fear in some people's minds. Our low volumes in our clinics were basically due to the COVID-19. People weren't coming in; they were staying home. And even if they didn't have COVID, if they needed to get their normal checks, it wasn't happening. And if you think, and I do certainly appreciate, we had several businesses that donated some PPE to us early on. We had some pressures because we had just come out of the normal flu season, which normally runs from October through about March. So we had burned up all of our PPE reserves, taking care of our patients that already had, we'd use in a normal, typical flu season. And ordering those and getting that PPE back in to protect not only our patients, but certainly our staff, was a very important thing. So we had to do some scrambling out there. But once again, I appreciate those that donated PPE to us early on, whether it was handmade or whether it was something that you already had on stockage. Murray State was one of those, and then several others. CARES money began to roll in for us, and that came from the CARES Act. And we got a Medicare advance payments to kind of help us during that time frame. If you can imagine what your business would be like, in the month of April, our business was so bad, we lost $4.5 million. That was pretty much a hit for the hospital. As we rolled into June and August of 2020, things began to change a little bit. COVID began to become more prevalent into our area. We ramped up in our volumes, and we had some genuinely sickly patients. And you think, well, of course, COVID patients are sickly, but that's not what I'm talking about. I'm really talking about the normal patient that comes through the door. Those that have COPDs, or those that have emphysema, or those that have heart issues, and others issues. They started to roll in because I think they delayed their care. And we're still seeing that today. And then you overlay that with the COVID patients that started to come into us. And a trigger point was about 2 weeks to 3 weeks after every major holiday. Now, if you can imagine, because of the pneumonias that this COVID disease causes, the virus causes, the oxygen utilization in the hospital just absolutely began to skyrocket, creeped up. And I'll talk a little bit more of that once we get down into the October timeframe. And the hard part about this, we were learning on the fly. There was no, and I heard this described yesterday, there was no playbook. We had no volume of medicine that could talk about what COVID was all about. So our physicians were learning as it was happening. And that's a very difficult situation to be in when you normally have been presented with medicine techniques that you've gotten and gained over 30 and 40 and 50 years of doing business. But we didn't have that to be able to help us out. Now, I really want to focus a little bit on the last 4 months. So October through January of this year has been, as I refer to down there, as the real deal. And I say that from the standpoint is we've just absolutely been overrun by the amount of patients, and not just here, but across this entire region. To give you an example of our oxygen requirements, typically I would refill our oxygen cylinders to support this hospital, our patients, about once a month. We were down at some point refilling our oxygen cylinders every 3 to 4 days. And that's just to take care of the patients that we had. So between the patients that were in our emergency department and on the floors, and don't forget the transfer challenges, because what was happening was we were not able to transfer patients from one hospital to another, because the first question they'd ask is, do they have COVID? If the answer was yes, typically we got a no. So that's been a little bit of a challenge for us. So here's a snapshot right now of Maury Calloway County. We've got 14 COVID patients in-house. And I mentioned that COVID floor that we created. 14 fortunately, they're all in the acute areas. And we hate when they get into our CCU because we know that they become a little bit more challenge for us. And if you look down below, I'll give you a snapshot since July. And I really appreciate Jeff Eyes, my chief nursing executive, has been watching these numbers for really months and months, not only for us, but also for the community. You can see the stair steps, and I don't know if you can see my pointer, but as I'm walking through that, right around that, that October timeframe, then and that's right after about a month after we had the Labor Day weekend. Then we roll into November. We had really a crescendo there, and it dropped down a little bit there it started December. But the amazing thing, we shot right back up because we had some major holidays again to have to deal with. So people get together, and unfortunately, that was a challenge for us. Our positivity rate's a little higher than the state. We're running about just around 11%. And then you can see the number of cases we have, daily cases in the Calloway area. And we rank among the highest ones here in the Western Kentucky, the true Western Kentucky region. What I'm showing you now is what did our admissions look like? So in October, we averaged about 20 COVID admissions in the hospital any given time. And by November, it had jumped up to 55. Then it went up to 66 in December, and it's dropped off a little bit down to 53 in January. And when you look at our patient days, again, that line follows what you saw with the admissions. But really, here's the linchpin on this. If you drop down the lower left-hand side of your slide, with the average length of stay, COVID patients, normally our lengths of stay for our patients are about 4.5 days if they come in and they're sick. COVID patients were already starting out in October, somewhere about 6.5, and it ran to just about 8 in December and dropped down to about 7.83 in January. We can't get rid of patients once we get them here. And they're very hard to be able to just release because one, we want to make sure they're not spewing virus when they get back home to their families. And two, the pneumonia process they go through and the other processes that we see with the blood clots and other things that are involved really have created challenges for us. And I've rolled it all together in this bottom slide here, looking at and overlaid the patient days and the admissions with the lengths of stay. So been a very difficult time. And as I said, it's been big business for us here in the hospital. Just talk a little bit about the emergency department. As I mentioned, the one gentleman did not want to come to the emergency room because he was afraid he was going to catch COVID. And that's been by the way, as we changed the airflow on the floors, we also changed it down in the emergency department. So we created a negative pressure environment there too to protect anybody coming in through the door. So what you're looking at now is a slide from October. And we've got if you look at the graph below, the known positives, the swabs obtained, and the total number of patients. So the blue line represents how many patients we saw in any given week. And again, October, I know first and third has more than 3 days, but that just means it ended that type of week, and I didn't want to stem back into the prior month. So you see the total numbers of patients on a typical day or typical month there in October was about 300 to 350. The number of swabs, that we gave patients when they came through the door, meaning they had potential of having COVID, was pretty high. And the number of known positive patients, that means they walked in the door and said, "I'm COVID positive," was again a very high number for us. So what does that mean to us? Well, I got up here in the top right where it says the room turnover is 1.5 hours. The CDC was requiring us to allow each room to have to rest for 45 minutes to air out. And then it took another 45 minutes for our teams to come in and clean that room stem to stern. That means lights, that means bed, that means the floor, that means the walls, everything. And if you can imagine, I only have 12 rooms in the ER. And if you lose a room for an hour and a half, the major impact when you have the volume of patients you have. Well, it didn't get any better in November. And you can see again, as you look through the slide, that we started going between 300 and 350. Again, kind of what you saw in the prior month. But now you see a couple of other things that have been introduced here. And I'll talk a little bit more about these IV infusions as I get into the next month. In December, you saw these IV infusions increase again. And the number of patients, although it dropped in December, remember the number of admissions that we had. If you saw the slide earlier, when I talked about that huge spike that we had in December, we're actually admitting more patients now than we ever have by the number of patients we see. Typically, patients that come into my emergency department, we will admit about 12 to 13%. Since COVID hit us, we are now admitting somewhere between 17, 18, and in December, it hit a peak of 20.3% of anybody walking, 1/5 of every person, of the group that walked into the emergency room on any given day got admitted. In January, we saw the same sort of thing. And again, I'm pointing out these infusions, and I'm going to lead to that a little bit on the next slide. So what are those infusions? You've heard about these. We've talked about the Regeneron that I say up close and personal. I guess we like to joke and call it the Trump teeny, because it really is the president got that several months back. It kind of brought it to the forefront in our media. And then we have something we call BAM. And if you want to pronounce this bamlanivimab every single time you talk about it, you know why my staff just calls it BAM, because it's too much to just spit out every single time. But this was a game changer for us, having this monoclonal antibody therapy. And we began to give that not only in our emergency department, but we also gave it our Murray Medical clinics that really helped us out. And the game plan of using the monoclonal therapy is to keep patients out of the hospital. So we got somebody that's high risk and they're early in their treatment, early in their identification. We want to try to give that to them. So here's some of the indications that we use it for. So it's for adults, pediatric patients of 12 years and older. And if they have some mild or moderate potential of getting the disease, that we want to try to infuse them. And it's really done a fantastic thing. It's not to keep giving to our patients that are in the hospital. That's not the intent, because our game plan is to keep them out of the hospital. And it really works well. And of course, if they have some sort of oxygen deficit, then the monoclonal is something we don't want to try to do. But it is an extra tool that we had in our kit bag that we didn't have starting this thing back in the March timeframe. So give you kind of the overall numbers. We did 8 of those in November. We did 57 in December, and that's both the Regeneron and the BAM. And then we did 164 in December. The thing I wanted to point out to you, think your little hospital's not progressive. Well, we were the first one in the region that began using the BAM. And then we actually beat the Mayo Clinic by 2 days. We started using it before they did. And we just felt, don't leave it on the shelf. Let's go ahead and do it. They want to staff all their things and run it through processes. We already knew it was safe. We already done all the reading. Our doctors had done everything they needed to do, and it doesn't do any good if we don't put it in people's bodies to be able to help them out. We're a little bit afraid right now. People are starting to see these variants coming down the way, and we've dealt with variants and viruses for a long time. For instance, in flu, we talk about flu A, and we talk about flu B swabs, and we talk about H1N1, the swine flu. And man, there's a lot of H1N blank blanks that we have out there. There's a lot of variants. And that happens because when viruses get into the body, they replicate. And when they replicate it in huge numbers, upwards in the hundreds of thousands to millions once they get spread from person to person to person. And as you know, I guess in genetics, things happen. And variants then are coming out when you have so many different replications of these viruses. So the current strain that we're dealing with, we've learned how to deal with it as much as we possibly can. But if you've probably read in the news, there's a UK strain right now, which is the predominant strain in the United Kingdom at this point in time, coming to our area. And yes, we've had a couple of cases in the state of Kentucky already. There's a South American strain and a South African strain. And those are important because remember, when the initial the vaccines were made, they were made to be able to fight the strain that you're dealing with at the time. Just like the CDC makes the call on what kind of cocktail they're going to give us for every flu shot, then the same thing is when it's going to come down, I guess, as we move forward in the future and how we're going to deal with coronavirus. So we're going to keep these on our periphery. We're going to watch these a little bit. But overall, our vaccines at this point are effective against against these particular variants that are coming out. From the vaccine horizon, one size definitely does not fit all. What I mean by that, not every vaccine is going to do exactly the same thing. The Pfizer product, when it got its emergency use authorization, it was 2 doses. It was given 3 weeks apart. And that was initially put into places like our assisted living facilities and nursing home. And I know at Spring Creek, in a contract that came from the federal government, they had an opportunity to get that through some of our local pharmacies. Now, we at the hospital were given the Moderna. Now, Moderna is 2 doses, but it's 28 days apart. Now, both of these 2 vaccines are about 95% effective against the current variant that we're dealing with. And I can tell you, we've rolled out about 700 doses plus to our healthcare workers, and many people around the area, we're just our healthcare workers. There were certainly those that were sitters in the healthcare environments. We talked about our coroner, to our funeral directors that were dealing with those that had passed with corona. It was important for us to make sure we got as many people as we possibly could in our healthcare fields, not just here in the hospital, but surrounding in our community as well. And the health department was absolutely fantastic in doing that and identifying people throughout our community to make sure we're taken care of. one of the questions I get is the timing of the vaccine important when we get these? So for instance, let's say I got the Moderna, and I'm not going to show you my card here, but I actually have my card sitting in front of me. And so I've had both doses of Moderna. But people say, well, if I don't get it on the 28th day after I got the last inoculation, is that going to be okay? And the answer is yes. You can't get it any earlier than 24 days to make the maximum efficiency of the virus, of the vaccine. But you certainly can wait beyond 28 days, because what we're looking for is an immune response for your body, and want to try to do as best we can. A lot of questions we get is about oh gosh, is this going to make me sick? Not any more than a flu vaccine that you're going to have out there. Typically, our enhanced immune responses can be anything. You have a sore arm, you may get a little knot at the inoculation site. Low-grade fever has been something that's been pretty common, chills in some cases. And I know one person out of that 700 that had some nausea and vomiting. So a true 12 to 24 to 48 hour, 36 hour worth of a flu, sort of a flare-up. But otherwise, folks are fine. And for you in the business area, just to let you know, when your folks start getting the vaccines, ask them to stagger it out a little bit within your workforce, because you may have people call in sick. And we had some folks that would call in sick because they just didn't feel well. They had some body aches. Maybe they had the low-grade fever. And of course, in hospitals, we don't like any of our staff working if they have any fever whatsoever. Also in the horizon, we've got the J&J vaccine that's coming in our direction. Johnson & Johnson's been working on it. This is a one-shot vaccine, and right now it's about 66% effective against the virus. And it may not prevent you from getting the virus, but it will certainly lessen the effects that when you get it. In U.S. trials right now, we're seeing that it's about 72% effective, and then the South African trials have been about 57% with the variant there. So it doesn't mean it doesn't work when I say that they're not 95 or 100% effective. It just means they're going to give you some a level of protection against once you get the virus itself. And to give you an example of what our normal environment would be, so on a flu vaccine last year in 2019, from the CDC numbers, our flu vaccine was about 46% effective. So, I mean, that's just what we're already taking. So I'm just giving that to you as a comparison. You can say, okay, I understand what you mean, that nothing's 100%, but we're trying to do the best we possibly can. And I tell you, science has been wonderful for us in rolling out the vaccines that we have today. And the last one I just mentioned, there's the Novavax vaccine. It's about 90% effective. It's currently in phase 3 trials. And you have that protection after 7 days after you get the second shot. So a 90% efficacy against a particular vaccine is really, really pretty good. Bringing that down from that macro level down to the state level, what's happening? Because people are clamoring, they want this vaccine. We understand it. Right now, the state was getting about 56,000 doses a week, and now they're up to 62,000. They got a 60% plus up that we think is going to start rolling into them. And I was listening yesterday to Mark Carter talk about this as we were with the Town and Gown presentation. And he said, take about 40 weeks to distribute this to roughly 2.4 million Kentuckians. Well, I know all of you just did your quick math and said, well, geez, that's not until November, Jerry. And you're exactly right. It's a long, long time. So it's going to come more fast and furious as we begin to unleash more and more of the vaccine to the community. And I know that's important. We want to try to do as fast as we can to get vaccine in people's arms. I've heard people talk to me about, well, I called Paducah and I'm on a list, or I called the health department on a list. Well, I just want to let you know the lists don't guarantee you a vaccine. That just means you're on a list. So don't put a lot of stock in that right now, because the most important thing is when you get an appointment to get the vaccine. That's what I want you to focus in on. Another question has come up, and we continue to get this in our healthcare areas. Well, how come we're not a site? How come we haven't been given the opportunity to be a site? So I think there's 33 around the state right now. Well, unfortunately, Dr. Stack, who's the lead sled dog for the governor in dealing with this, along with Jim Gray, got about 1,100 requests of people across the state saying, yeah, we love to be a vaccination site. Well, you just can't do that. If you can imagine the amount of vaccine we're getting, that 62,000 being the size of a pie, and you got to figure out how to slice that pie in the right way. So everybody, 2.4 million Kentuckians get that. That's a tough way to do that, because if you don't have 2.4 million doses, you automatically start figuring, where do you put it? And that's the real challenges we have right now. Now, has Calloway County put in for one of these sites? Sure, we have. Of course we have. We love to be able to take care of our community. And as I said, these stakeholders that I talked about earlier back in February, we've been working together trying to figure out ways that we can, one, make this community as safe as we possibly can. So don't be surprised at some point in time if we're fortunate enough to get tapped. It's a great thing for our community, but don't be surprised if we don't. Because man, again, we're competing with about 1,100 sites out there trying to say, yeah, please, we want to get this to our community because we know we do. We want it. Some of the medical offices and health department have already created lists because what we're doing is starting to identify our over 70 population. We know we want to get it to them as first as we possibly can. There's 3,000 plus over 70s in Calloway County alone. That's some challenges. And I know in my own, in Murray Medical, we pulled about 1,000. So that's a lot of names and people we got to call to make sure we get it. And at some point in time, it will come down to the medical offices, but that may be a year away. Right now, we're talking about mass vaccination sites. Will be the best thing for us. I do think that we'll start to get a greater resolution here in the month of February and as we go into the future months on how the vaccine rollout is going to be, not only for our state, but how it's going to happen coming from the federal government, getting it to us. I want to close real quickly, and so I'll take a few questions. I got some questions also that Michelle had already loaded up for me. Some points of pride I just want you to be very aware of. That for me as a CEO of the hospital, in your local community hospital, we got a bunch of fantastic teams here in the hospital that have to really work hard. Spring Creek did a yeoman's job of taking care of most of their folks out there over 70, and they are the most at risk that we possibly have in our community and have done a great job. When we got hit back in the early March through May timeframe, and beyond, our team did it. They just were selfless. And we cut 20% of our hours across the board. Our directors and vice presidents took a 20 to 30% pay cut. Our physicians volunteered to take a 25% pay cut. That's tough for physicians because they're not used to that, but yet they were willing to do that for our community just to make sure our hospital stayed afloat. And we put our surgeons, as I mentioned earlier, on a shelf for 60 days. And you know what? I didn't have one single complaint, none. And I know you all went through the same thing because your businesses were shut down, but we weren't. We still had to provide care and we still had to do what we needed to do. A second point of pride is that remarkable nursing staff that you have here in this community, really, and they've been working hard. We lost people almost initially, some of our older folks that were PRN staff that were nurses, because they were in that 60 and 70 plus range that worked. They would work 1 or 2 shifts a week, and they were afraid to catch COVID, so they just retired. That was tough. And every single hospital in this area was fighting for nursing staff, and it continued to fight for nursing staff. Typically our nursing staff gets paid anywhere in that $20 to $30 an hour range, and agency staff zoomed up to as high as $77 an hour and it topped out at over $200 an hour to try to get an agency nurse to the hospital. That's absolutely crazy. So it's a tremendous shift, and they've been working long hours and multiple shifts, and really in the ER and down in the COVID wing of our hospital, doing really, really great stuff. We got patted on the back way back in March through May timeframe, and we really didn't have a lot of COVID patients. We kind of felt bad having to get the pats on the back. My team is working harder now, and the pace has been absolutely ridiculously high. And I tell you, this week alone has just been a tremendous challenge for our facility and for our staff. The last two things I want to hit on is willingness of our staff to adapt to different areas. We opened up our own drive-through. We opened up our own daycare, because as the daycares got shut down, we had to send our staff had to go somewhere, or they had to stay home. So I asked people to work in different areas, and one was to work in a daycare. We opened up a respiratory illness clinic. Security guards became temperature checkers. Just as an example, we had to do what we needed to do to take care of you who's coming in through the door and those that we were taking care of. And then last but not least, I mentioned, we do appreciate you really recognizing us, whether it be through donations of PPE, maybe through your food donations. We received donuts and other sweets and chocolates and sandwiches, pizzas, just pats on the back. And it's been absolutely wonderful. Comments on Facebook. You've been a motivational force behind our heroes here at the hospital. And I just want to thank you for appreciating them throughout. And it's been, we're happy to serve you. This is what we do. We've never been asked to do this to this level that we've ever had to do. It's in my 10 years here, but we're proud to do it for this community, because we're real proud of the Calloway County and the city of Murray. So glad to do our part. I'm gonna take a couple questions that came in, Michelle, and I don't know if you want to have some that have already come in, but I've got some behind this slide. If you want to just flash those up and I could run through those, whichever way you'd like to do that.
I'll just ask you a few questions, if you can hear me, just that were submitted upon registration.
Sure.
And we heard a little bit from you about the vaccinations and the phases that we're in. And you said getting on a list or a wait list. Can you explain maybe how to get an appointment, what providers locally are providing that? And then do they take preference based on the phases of who gets them when in those offices?
Right. The easy answer there is there are no appointments for vaccines right now. Until we get the vaccine, it's going to be some time before we're able to set up appointments. Now, if we were lucky enough to get tapped to be a max vaccination site, then great. There are plans in place to be able to roll that out to make sure we take care of people in an expeditious manner. So that's important for people to understand that even though you've heard it's coming to Paducah and they got tapped as a couple regional sites up there, you can get on a list, but a list doesn't mean you have an appointment. And I can tell you, I have contacted the CEOs up there, and the vaccine has not arrived for max vaccination at this point in time. And then as far as timelines are concerned, they did talk about that a little bit yesterday morning. Mark Harder, he feels very strongly that the over 70 population is going to happen in the February through early March timeframe. So I think it's where we need to focus right now is getting that vaccine here, getting designated if we're so lucky to get that opportunity, and get it out where we can get people with vaccine in their arms. That's the most important thing. So there's light at the end of the tunnel. And there is a schedule they're looking at potentially rolling out, and when they're going to start getting to the 1C and then into the 2, 3, and 4 categories of the patients that we have out there, all the way down to our 16-year-olds and above. And that could happen anywhere to late summer and beyond. So there's a chart. They're pushing forward, they being the state. And we're just waiting with bated breath, hoping that we can provide that for the community. But to answer your question, right now, no, there are no appointments that are available because nobody has the vaccine.
I think this will be the last question we get to. Have we considered how the mass vaccination for the majority of the public will look once we're to that phase? So once everyone has sort of received the vaccination, what will that look like in terms of getting back to normalcy?
Well, I think that's once we get everybody inoculated, it's going to be a lot like what we're seeing now with flu A, flu B, and H1N1. So that'll be the routine year after year after year as we begin to make sure that people are taking the vaccine. As an example, this year we did a great job and people came out in mass force to get the vaccine for flu. And I can tell you, we've had 0 flu this year, just very, very, very tiny as compared to COVID. And in past years, we had, usually large flu seasons. This year, it's been almost non-existent. So that's going to be our future. People will take the vaccine, and I highly encourage people to do so, to take the vaccine. Don't be afraid of it. These multi-billion-dollar organizations would never create a vaccine that's not going to work. They would do that because they would lose their shirt by putting their name behind a product that doesn't work. So we need our over 70s stepping in line to do that. And those with chronic illnesses, they need to make sure they do that and get the vaccine. Don't be afraid of it. If you're worried about having a little fever and chills or doing those things, I mean, that's like 10% of the folks are going to have some sort of enhanced immune response. As I watched my staff get it and myself, getting the vaccine, I didn't have a single problem. My arm didn't get sore or anything. So we've got to make sure we get that message across that don't be afraid of the vaccine. Be afraid of COVID. That's what you need to worry about.
We had one question just come in. Are neighboring counties getting the vaccine before us, or what have you seen kind of in the region for that?
Again, the healthcare workers got their supply of vaccines. So hospitals got it. The 128 hospitals and health departments across the state got the vaccine to particularly go after the 1B population, which was our 1A population, which is our healthcare workers and first responders. We did a great job of doing that. There was a second batch of vaccine that came out that was targeted from the state directly to our school systems. They weren't the same vaccine. I mean, same vaccine, but just weren't the same track, because they were trying to make sure they were, the state was trying to roll this out in a very methodical way to take care of those that are going to be at most at risk and to get our teachers back to school. and of course, healthcare workers because of what we do and how we take care of. Other counties are the same way. If there was any vaccine left over from what they got, they were given authorization to go ahead and hit some of the over 70s, but those were very, very, very small numbers. And as I said, I talked to both the CEOs up at Paducah. They have not had the vaccine for the mass population yet. They did do a few of the over 70s because, one, you don't want to leave it on the shelf. And we were instructed by the state to make sure you got it out in somebody's arm. But we're talking small numbers, in the hundreds or less than it would be in the thousands that we need to make sure we take care of everybody.
Well, Jerry, we really appreciate your time this morning to speak with us and share about the hospital and update on our community health and what we can expect with vaccinations and the pandemic. Truly appreciate our frontline healthcare workers. We know that you guys you're still in the middle of it. And as some of us have moved on a little bit, we know that doctors, nurses, and your whole staff are working really hard to keep our community safe. And we truly, truly appreciate your team.
Thank you, Michelle, and thank you so much for allowing me to be the first and the inaugural speaker for 2021. I hope this is a better year for all of us. We need that. The businesses out there need that. I feel for your heart goes out to you. We need to turn the corner on this, and the best thing we can do is, one, help me help you, and that is when that vaccine becomes available. Please, I would love for my census in the hospital to go down. It's good for business. It's bad for the community, and I'd rather you be healthy than being here.
Well, thank you again for joining us this morning. And with that, we are going to conclude our breakfast this morning, virtual breakfast, I should say. And we have the opportunity now for you to join some networking. We know that's one thing our members say they miss is seeing everyone. So if you'll go to the chat, which is at the bottom, there's a link there to join a networking meeting where you can further discuss things with a representative from the chamber. And we're happy just to see one another and get to hear from one another through that opportunity. But thank you for joining us. Thank you, Jeanette, our chair of the board, for being here and leading us this morning. Thank you to Lake Chem for this opportunity to provide our members with an update. If you have any questions following this, just shoot them to us through email. We'll be happy to get those in front of Jerry, and I know he would be happy to answer those questions for you as well. But thank you so much for joining us, and we hope you have a wonderful day. So join the chat now and go to our networking opportunity.